illness, you think about how to treat the symptoms, right? So you give me an inhaler and you'd say, okay, take this when you have an asthma attack. But I want us to take a few steps back before we do that and think about our environment and the way that plays a role in what we do. So right now we hear a lot of discussion about climate change and different pollutants like air pollution and water pollution. So I want to talk a little more about air pollution. So in a lot of urban settings, we hear issues that relate to air pollution. These air pollutants can often lead to a lot of other health complications, like lung issues like asthma and pneumonia, but they can also be linked to heart issues like heart attacks and along with that, strokes as well. So urban areas and living in urban settings, you're often left vulnerable to a lot of air pollutants and inhaling these on a regular basis. But how susceptible you are to air pollutants is also determined by another factor, and that's socioeconomic status. The communities that you live in and how vulnerable you are left to different types of pollutions is very heavily impacted by your socioeconomic status. Even the amount of trees that are planted in communities is determined by how wealthy you are. In wealthier neighborhoods, you'll find, in especially urban areas like even New York, you'll find more trees. And in poorer and more rural areas, you'll find fewer trees. So that will leave residents more susceptible to things like air pollution, because in areas with more trees, you'll have fewer pollutants in the air because the trees will be filtering the air. But in more rural areas, you won't have this. So this leaves residents more susceptible to getting sicknesses through pollutants. But they're also less able to treat their sicknesses because healthcare in the United States is so expensive and hard to access. This kind of leaves people in this cycle of not knowing what to do, and when you go into the doctor's office, they're telling you how to treat your symptoms, and you don't really know why you're constantly coming back and getting sick over and over again because your environment hasn't been changed at all. This can also impact children. So children they need to go outside, they need to get exercise, they need to be able to play. But when you're living in a neighborhood where you're not given access to a playground or you're not given places where you can safely play outside, children aren't able to get that mandatory amount of exercise or that mandatory amount of nutrients and going outside and getting that sunlight. So then children are also left stunted at that area because from a young age, they're just not getting the same access to things as wealthier children are. Which is why when we think about sickness, we need to think about more than just what has immediately caused sickness or what the symptoms are. We need to think about their environment and why they're in this situation in the first place. And we need to take a step back and change the environment that they're in and make positive strides towards that and change infrastructure so that it helps more people. I want us to take a step back and think about, rather than just giving a prescription and treating an illness, looking at communities and making them better and building them up. If we see many children having an issue because of lead poisoning, rather than leaving them behind like we did in Flint and we didn't help them and change their pipes the way we should have, we just kind of left them there because it was Flint. Instead, we should change their environment for the better so that they can strive for better things in life later. Thank you.